I'm the private assessor of Denver Health. I just received your message.
You're the who? I'm sorry?
My name is Michael Grimpo. I'm the privacy officer at Denver Health.
Oh, hi, Michael. How are you today?
Good. How are you?
I'm doing all right. Thank you.
Hey, I received your message. Just something about a privacy violation in the medical records department. Just curious what is going on. How we can help you?
Oh, man, thank you so much for reaching out. To be honest, you are probably the first person from Denver Health to actually follow up. So I appreciate it.
That is unfortunate.
Yeah, I really appreciate this. So on February. My brain's all sorts of messed up because I've been dealing with this so much. In April, I don't want to give like exact dates and time over the phone because I don't have the record in front of me, but I'll give you the overview. April in the morning, I went in there to request my records.
Okay.
So as I'm requesting my records, I'm noticing that Lindsay Moore, the employee who's printing it off the records, she's acting very weird. Basically, she's continuing to type stuff as she's like doing stuff. And then when I was like, hey, like, what are you typing? Because obviously you're working on my record. And then all of a sudden she's like, something happened, and she just stood up and walked away.
Okay, that is odd.
Yeah, it is. And then to make things worse, so prior to even printing my record, she should have checked my ID. Right?
Yes.
She did not check my ID before she printed my records.
Okay.
And then, again, making things even more weird, I was there just to like actually inquire about a prescription that I have received in February that I couldn't find anywhere.
Okay.
So then when I requested it, at first she was like, well, I only have the notes. I'm like, you don't have the medication list? She's like, and then they were able to find the medication list, but it was weird. The guy who helped her was super rude about everything. He was like, it doesn't even matter. It's not like you're going to win a court case with this. And I was like, dude, you don't even understand. That's not what even this is about. I'm just trying to get the help.
Okay.
And so basically they couldn't find it. They found like a weird one. I have this paper in front of me. I'll just read off what's on it. 1 second. So inside this paper, it's saying that there's a warning history, and the total number of overridden warnings is 10.
Why?
I don't know. And then it also has
total number of overwritten warnings is 10?
Yes.
Okay.
And then underneath it has order audit trail. And inside this, it says number of times this order has been changed since signing. 4.
And is it talking about your prescription order?
To be honest with you, I don't know. I have no, probably, but I have no actual idea because, like, just for what it's worth, I do understand databasing in sets of this sort. And I believe this was like something that they had to just like force print to show me because I was requesting it because they couldn't find the actual one.
Okay. Yeah, the only thing I can think of is there are a lot of rules around prescriptions and how many times they can be refilled and filled. So if there was some kind of a warning that popped up around the medication itself, that would make sense. But that's... Yeah, I'm not sure what that means.
Yeah, I think
that's just what comes to my mind.
For sure. I mean, and I guess just to give you more insight onto like what I've been dealing with, I believe that the dermatologist did not actually give me care on the day she should have.
Okay.
My condition got worse. That's why I came back in February 2022 to get help. And that doctor actually did prescribe me something that helped, but it kind of totally contradicted what the dermatologist had said. And ever since February is actually when all my medical records started like really getting messed up. For example, for that one, I guess I know I'm just throwing out a lot of dates here, so I'm sorry. Back in May of 2021, inside my legal medical record, it is showing information for this visit of February 2022, which, in my opinion, would be totally impossible to have known in May of 2021 because it was an urgent care visit.
So is it records that you received in May of 2021?
No, I just reprinted all of my records.
I see.
So,
okay.
And again, just like researching here, having backdates of this sort in a medical record isn't good. And also, it's like, again, I know that you work with privacy. I don't know what your understanding of the medical record side of things are. Do you have a pretty good understanding of it?
Yes.
Okay. Cool. Perfect. I can basically show you like the trail of where things started changing, as well as there are multiple after visit summaries under like one visit. Like for one of them, I think has like 3 different after visit summaries.
Okay. Yeah, that's odd. One thing I can say about the after visit summary, that's a very odd document in our medical record, simply because the after visit summary is always changing. So typically when you get your medical record, you'll get the most recent after visit summary. It doesn't necessarily like kind of snapshot every one of them and then save a copy. It's kind of this ever-changing copy. It's a terrible document, honestly. And I know that one specifically has a lot of problems. The way it's stored specifically.
Yeah, but I think as far as like my actual legal medical record is concerned, there would be no reason for that snapshot of the after visit summary to be changed within my legal medical record. And that's what
there shouldn't be.
Yeah, and that's what I'm saying, to a point where it's like I have after visit summaries. So again, you know a lot about this, so this is actually a nice conversation to have with somebody. I have after visit summaries that have their medication date and time and print time, right? All of them have like all that on there. And then at the bottom of the after visit summary, it always shows the time that the after visit summary is printed and the date. Right?
Yes.
So I have after visit summaries that show a different print and date time versus when the after visit summary was printed for medication.
And are these paper copies, or are you looking at like after visit summaries in my charter?
This is in my legal medical record that I have electronically that I requested, the OI.
Okay.
Yeah.
Okay. So you're not talking about the after visit summary that actually print and hand to you at your visit. You're talking about kind of after the fact you got a copy of it, right?
Yeah. And I think it's because, like, again, during this time is when everything started getting really weird.
Mm-hmm.
So.
Yeah, I would have to look at kind of how those timestamps on that document works. Like I said, that's a weird document, that after visit summary, because it's something that it changes as you come. Each time you come in, it updates itself rather than generating a new one. The way it lives in our medical record is this living document that's constantly updating. It's not, each time you come in, it doesn't create a new after visit summary. It updates the old one, which is why that document is problematic.
Yeah, and
particular.
That's fine that it's problematic and all, but like it's problematic, I believe, also opens way to physicians committing fraud.
Yeah.
Because they know they can just add on additional after visit summaries with different information.
Okay. And when you say your medical records were getting weird at this time, is there more that was going on that caused you alarm?
Yes. I mean, how much time do you have?
Let me check, actually.
Yeah, right. That's fair. I respect you so much, Michael. Right?
I know. Yes.
Michael,
I've got a meeting coming up here. I've got about 20 minutes, actually. So.
Okay. So let me just. Where should I? What I guess like what would you like to know?
Well, so I'm the privacy officer, so I'm primarily going to be focused on the medical records part and privacy, obviously. You mentioned HIPAA. It sounds like maybe you had some concerns about that specifically when you went into the release information window. Is that where you went?
Yes, inside the actual hospital.
Yep, okay. And then it sounds like there's some more concerns potentially around the care you received with this dermatologist, which I can't address, but I could maybe help you get the person who can. It sounds like you also maybe had some problems with the release information staff, which I am, as the privacy person, kind of linked to the director of that department. Okay. We speak pretty much every day, so I can definitely help address issues with behavior of that staff. I can't, not directly, but in that way, I can definitely refer things over to essentially their, boss's boss, basically.
Well, can I ask you this question while I have your time?
Yeah.
Just because, again, I have so much confusion that I just did not understand. Medical records, I see that most of them, they start with like an entry point where it has like the room number, the time, and the diagnosis, right? And that's every medical record has that.
Yes.
And all of those boxes are always filled in.
Yes.
I have multiple records, especially for these dates in question, where they don't have the room number, they don't have the time and visit, and they don't have the diagnosis.
Okay, that's odd. Yeah, typically the way our medical record is organized is by encounter. So each time you come in or you go to a different place within the hospital, so you might have multiple encounters on one day, but typically, if you're coming in for one thing, that's one encounter.
Right.
And it would have where that encounter took place, like you said,
right,
and why the encounter took place. So that would be, not necessarily diagnosis, but an issue, like why did you come in? Right. And that would be at the top.
And I feel like because some of them, I think some of them have it, the other ones, the ones especially in question, do not have it. Like they don't have the room number, they don't have the diagnosis, none of that.
Yeah, and were they outpatient visits? Do you know?
I mean,
or were you admitted to the hospital?
I was not admitted. Okay. So this is like the dermatology appointments and some urgent care appointments.
So for dermatology, it probably wouldn't have a room number, but it would have, dermatology clinic or adult primary care, depending on where you went. For inpatient, they would give specifically usually a room number. You were in room number XYZ. But yeah, for an outpatient, usually, it should have the clinic name at least and the issue.
Right.
Essentially. And that's the way, when I'm looking in there, that's what I see is when it took place, the type of visit, the department it took place in, and then the provider, if there's a specific provider on there.
Right. And just so you know, like my records are 387 some odd pages, so I am...
That's nothing.
Yeah. Well, for me, it's a lot because I am piecing through it to like collect. I understand what you're saying, though. I bet you've seen. I can imagine.
No, people who are admitted for weeks, their records are insane. But yes, no, understood.
Yeah. And I guess so. It's like stuff like that is obviously a big concern, and because like I haven't been able to like really get through all of it, and it's just like so much. It's just so much that I'm like, I guess I'm even having a hard time like piecing it together because like I can't even really understand exactly which one sometimes or which encounter because it has so many multiple after visit summaries inside of it.
Okay. So I'll tell you what I can do kind of about this part. You don't know the name of the person. You said that you had Lindsay Moore was the person helping you. Is that right?
Yes.
At the desk?
Yes.
And then someone else came over and wasn't exactly helpful. You don't know that person's name, do you?
I don't. He was I guess a larger gentleman, had kind of longer hair, glasses.
Glasses?
Yeah.
Okay. So he does not work here anymore. I know that. And so they have kind of a new leadership over there. So one thing that I can definitely do is have them take a look at what they gave to you, from a different perspective, and try to explain why it looks the way it looks, to me or to you. I don't know if you'd rather have them call you directly. That might be better, because I wouldn't necessarily understand or translate everything correctly, but I'm happy to kind of act in the middle, if you'd rather, and just have them look, because they keep a record of what they gave you.
Oh yeah, and that's fine.
And they can look at that and see, what is he talking about, right?
Yeah,
and what does it actually look like? Because I can't look at it the way that they can.
Sure.
And why does it look that way? And maybe they have a good reason, and maybe they're like, what the heck? Like, this doesn't make any sense to us either.
Well, just to let you know, like, I always record all of my interactions with like anybody from Denver Health now, and like, I recorded a video visit that day, that shows all of this.
Okay.
And it shows him being like, okay, this is weird. Well, it's supposed to be here, and I was like, yeah, I know it's weird.
Who was that?
That was the gentleman who I guess is not there, but Lindsay was also there. And that's why it's like, when I was like, obviously I requested the same information that I had received electronically, but I didn't receive any of my medication list, and that was like the really important part. So I think it was like knowingly done, and unfortunately, like, that has prolonged my condition. I was only able just now to get diagnosed like earlier this month, thank God.
And that's not right. They should be able to get your medication list there. That's an easy. I mean, that's honestly, when you open a patient, that's one of the first things you see, because it's important. So that should be something they should get you. And if there's a problem with it, then they shouldn't just not give it to you. They should explain to you what's going on and fix it. Right. And if that problem is still there, I don't know if you've been in recently, but if there's still a problem with the medication list, it's got to be fixed.
To be honest with you, Michael, as of now, I am suffering from the retaliation of bringing head issues, because like, I basically lost my patient rights as a result. And today they just finally got back to me in regards to a report that another one of the head of legal, or Kim, she's like the senior clinical risk manager. She had told me that this had been done back in October, like a investigation.
Okay.
And again, she was, because I guess I didn't understand the whole Denver health policy. I wasn't able to like understand that like any investigation that she'd done would have to have also been like worked with compliance.
Okay.
And it wasn't.
Well.
Yeah, so then I recorded that conversation of her being like, oh, yeah, we did it, I investigated it, it's closed, it's settled, and then called compliance, and they're like, oh yeah, we're looking into it now. Called back Kim, and she's like, I don't know what you're talking about.
Is that Kim Johnson?
Kim Johnson, that's correct.
Okay.
So again,
interesting.
Yeah, it's been really crazy, and again, it's really actually more or less like destroyed my life. Like, I'm here Monday morning, doing this. Still.
Right, yeah, that should not be the case. Yeah. Can I ask you, Nick, how do I spell your last name?
My last name is spelled Coram, spelled Coram on the medical records. And believe it or not, I'm changing my last name today legally. So I'm going to be talking with a judge at 1 o'clock. So I'll just give you Coram now, and then like once that's officially done, I'll make sure to update everybody.
Okay. And you don't have your medical record number handy, do you?
Yes, I do. Yeah. Let me know when you're ready.
I'm ready. Okay. So I'm going to get with Kim also. She works just down the hall from me, which is always nice. So I can talk to her about what's going on there, and also speak with the medical records folks so I can find out what's going on with that medical record, if there's something that needs to be corrected, and see if they can speak with you sympathetic terms, let's say, to explain what is going on and what kind of the status is and what they can do to fix it, or I don't know. I don't know what the problem is.
I've already started drafting the pre-suit notice, so honestly, it is
Okay.
going to be a monetary thing.
Okay.
That's again, I've been pressed so far along to the point where I was only allowed to talk with the legal department, but then she did this. And, it's like weird. It's weird.
Understood.
It's weird when you have fraud policies and then commit fraud, and then it's like, dang, dude, I don't even know what to do anymore. So that's why I have to go this route. So I just want to let you know.
Sometimes that's what's left, yeah.
Yeah, and I really do appreciate everything you're doing and having the conversation with me. I don't want you to think like I'm not grateful, because I really am.
Okay.
But I do have to do this. I do need the payment. Like, I'm going to be losing my properties. I already have my car repossessed, so it's,
Yeah, you got to watch out for yourself. I understand that.
Yeah.
You can't always wait for us up here in our offices to get back to you, right?
Right.
I know. I appreciate that, and we try, but I don't know. I don't know what to say.
I get it. It's a business. I just wish that had everything, maybe had this not happened with Lindsay and I got the right information, I could have just gone elsewhere and took it to them to be show them. But it was just so hard every time to be like, hey. And then I would call the medical records office and ask them, be like, can you explain this to me? And they could not.
Okay. That's not right. So it sounds like they need to take a look at it, probably without you on the phone first, to prepare. They shouldn't have to figure it out while you're waiting, right? That's not going to work. They need to figure it out on their own time and provide you with an answer, in my opinion. So I'll see if I can help them along that path.
Sure. And the last legal record that I printed was October 14th.
Okay. And when you say you printed it, where did you get it printed from? The medical records office? They sent it to you, or you printed off a MyChart or similar?
Yeah. So they sent it to me. So it's via that drive. Okay. So I've already downloaded it. I've also had to oddly enough remove permissions from your guys' PDFs so that things can't be changed, because I think that's what you're saying about the whole after visit summary. It gets connected to the internet, so I think that also happens with this sometimes too. So and they sent it via email, is that correct?
That's
correct, yes.
Okay.
So I have that email, and that's the one I've been downloading pretty much continuously every day, just to make sure.
Okay. Yeah, I'd be curious how those how the email ones work, if they somehow link back like you're saying. Okay.
I think, believe it or not, I think they do, because again, just tech background over here. When I did upload it into some things, it kept saying that backlinks were being updated.
Yeah, like the cloud document.
Right.
And you're grabbing it fresh every time, so it could change.
Right. And
I don't think, just from my perspective, I'm not okay with that. It seems to me when we send a medical record, we should be sending it a snapshot at that point in time.
Yeah.
And not even trying to update in any way. If they want a fresh update, that's what our MyChart, that is for.
Right.
A medical records release should be a snapshot.
Right.
So
and
I can look into that also.
Yeah, knowing that, I put it into my Google Cloud storage and put it under a retention folder for 10 years, so it can't be done anymore. So.
Okay. Yeah, once you grab it down, it shouldn't update. But is it sitting in your email, pulling it from the cloud each time?
Right, and that's the thing. It's with it, with everything that I've made sure that it doesn't do. So it's again, things can't be added to these folders. It's just what it is what it is for the next 10 years, for sure.
That's what it should be, in my opinion. Okay, I'm going to get started on this and see what I can find out here on my end. I will let you know as quickly as I can here. I'm going to speak with both medical records and Kim Johnson, see if I can figure out what you're seeing, and we'll go from there.
Awesome. Thank you.
Thank you very much.
Yeah, have a good day.
Have a great day. Bye.